Good morning, good afternoon, good evening. Normally we would say from Berlin, and normally, of course, we would all hope to have been in Berlin. We can't be there. We're all over Europe, all over the world, actually. We'd like to welcome you very much to this discussion on multilateral public health partnerships during the COVID-19 crises. All the people in this panel are obviously still very, very engaged in responding to the crises. When we first planned this, we had hoped to be at another point in the pandemic than we are now. But I'm sure, we will talk and analyze some of the things that have happened and how important it has been to cooperate with one another. I have a fantastic panel here that I'm delighted to introduce. I'm not going to go through the long details of biographies. You can all find them online at the World Health Summit website. Obviously, they're all very distinguished people. First, Dr. Andrea Ammon, who is the director of the European Center for Disease Prevention and Control, ECDC. We have Dr. John Kengasong with us, who is the director of the African Centers for Disease Control and Prevention. We have with us Stephanie Seydoux, who is Ambassador for Global Health for France at the Ministry for Europe and Foreign Affairs. And I'm mentioning him last because he is Berlin-based, is Professor Dr. Lothar Wieler, who is the president of the Robert Koch Institute, the RKI, as we say in Germany. We are still hoping that our colleague from China will be able to join us, Professor George Gao, who is the director of the Centers for Disease Control and Prevention in China. But we will start our discussions and involve him if he is able to join. We just discussed maybe it's an issue of summertime changing to wintertime here in Europe. So we want to start with actually looking at the challenges these colleagues have faced. First of all, the colleagues who are directing centers for disease control at national or at the regional level, to sort of hear from them what really are the key challenges they faced. You will remember the Global Health Security Index analyzed, the amount of preparedness of various countries. There was less assessment of preparedness of whole regions like Africa, like the European region. And indeed, I think for the audience, it will be very important to also hear from you what are the particular challenges you think you face right now, particularly the two European colleagues in the context of the present increase in infections. And I will then ask Stephanie also to give some comments from a European perspective in terms of her role as an ambassador. So Andrea, if I turn to you, what are the greatest challenges you're actually facing from the perspective of the ECDC?
Yeah, thank you very much, Ilona, and hello to all my panelists and to the audience. As you know, we are a supranational center, and all the challenges that countries have at national level sort of accumulate and arrive at our level. I would like to name three main challenges that we saw. One is that countries had issues with rapidly escalating and maintaining a high testing and contact tracing capacity, which is basically the basis for all getting the information about what's going on. And at the beginning, this was mainly due to a lack of equipment, testing kits, but also regarding the laboratory staffing capacity and facility capacity. especially when then in spring the cases rose very rapidly. So that was the first thing. The second part that we found as a challenge is the difficulty some countries had in establishing robust and population-based surveillance systems. I mean, all these challenges link into each other. So the fact that the testing material was scarce led to the consequence that only certain groups were tested. That, of course, gave a certain picture. When you test only hospitalized cases, you get a different picture than when you have a broad population-based surveillance. So that was one thing. The other thing was that at the beginning, at least, there was a huge delay until data arrived at the European level. So we were never quite sure what the situation is. So we had to go really to the countries' websites where they published on a daily basis. And the third thing was that the course of events showed that the pandemic plans that countries have assured us that they have been reviewing and that they were prepared had some holes. And these holes were in particular in terms of the hospital preparedness, surge capacity, stockpiling, and so forth. In the intersectoral linking at the country level, so with other sectors than the health sector, and with the interoperability across the borders, in particular the neighboring countries. And lastly, regarding the risk communication, the dialogue and community engagement with the population that has such a crucial role in helping to make or to control the pandemic is not always given the attention that it needs. So these are, in short, the three main challenges. I can go in any detail if you would like.
Thank you, Andrea. I'll turn to John, hearing what Andrea has outlined as challenges. John, where are they different and similar if you look at it from the African CDC?
I think is thank you for the invitation to start with. I think and greetings to the colleagues on the panel, and Andrea, it's good to see you, and Rhoda, it's all good to see you all doing good in the midst of this challenge. It's amazing that the challenges that Andrea mentioned are very similar to those that we saw as a continent. I mean, starting with diagnostics. I mean, not needless to repeat what she said. The diagnostic was a great challenge and impediment. We had to send people to Berlin. Amazingly, we were in Berlin to Offert's lab to hand carry tests, PCR reagents to Addis Ababa for us to distribute across the continent. It was very challenging. And then suddenly the skies were all closed and we had to arrange for DHL services to leave Berlin to Dakar to stockpile at the Pasteur Institute there, and then we distribute across the continent. So it has been, early days were very challenging. It was really thanks to the cooperation and understanding that Offert's lab in Berlin worked with us to elevate that challenge. The second area is that I think Andrea didn't mention this, which was probably not an issue, of course, in Europe, was access to personal protective equipment. That was very important for our IPC, that is the infection prevention control measures. I think we struggled with that, but the situation has evolved. We have now many countries developing their own PPEs locally in Africa. I think that is a good thing that has happened. Then thirdly is the human resources needed for surveillance. As again, Andrea mentioned this, we had to, just early days, just as an illustration, we had a military plane from Cameroon to go to DRC, pick 30 responders, drop them in Mali, Burkina Faso, Niger, so that they can respond, because the skies were all locked. Countries needed help. Some countries were struggling. We worked with the Peace and Security Council of the AU. They offered out a military plane, and we had to do those gymnastics just to reinforce our workforce capacity. And lastly, the community understanding what Andrea mentioned as risk communication. I think there was a lot of misinformation, and we had to fight hard to make sure that we won and with the community trust. And I think that happened with time and the policy. I mean, what I call policy implementation was also critical. So I think those are some of the things that we faced early on. I would be happy to discuss some of the things that work for us.
Thank you very much, John, and thank you for making it so tangible, you know, how these things really work out on the everyday level. Lothar, if I turn to you, you were sort of dealing with things at different levels. We heard how Berlin and Germany supported Africa. You will surely have been involved at the European level. There is, you know, all the coordination needed within Germany as a major challenge. Can you just describe a little bit how that happens day to day in your work? What are these challenges?
Thank you very much. Also, I'd like to express my gratitude to be here on this panel. Before I go into these challenges, let me briefly say that actually, apart from all the downfalls over this, we have never been better prepared than this time. It's not enough, but it has been never better. And the reason there is that over the last years, particularly since I took office in March 2015, we pushed a lot to have more international cooperation with other partners. And I mean, this is something we would all agree. Without international partners, trust and cooperation, handling this pandemic wouldn't be half as good. It would have been a disaster. It anyway is a huge challenge, but it would have been disastrous. And I like what John said, that we support each other so much. And this is something we have to learn, and this is something we have to learn in peacetime. So this is, for me, the major topic here is, and all the, what has been mentioned before, the major topic here is trust, trust, and trust. And the trust on the local level, that is the most important trust, because on the local level, there will be the interventions. But of course, then it goes up to the federal level and to the supranational level. And what I think is the most important here is what you, I mean, Ilona, you do it for such, in a perfect way for decades, diplomacy. Yeah? It's diplomacy and letting people to know each other, building up trust. And so what we did from the Robert Koch Institute in advance of this, basically, over the last 3 years, then finally, after 2 years pushing, since 3 years, we have some results here at the Robert Koch Institute. The first is that the so-called Legal Protection Act, that is the basis for the German handling of infectious diseases, has been changed so that for the first time, employees of the Robert Koch Institute on a legal base can be deployed to other countries. I mean, this is a huge step. Yeah? We are a federal office, a federal institution, but we can deploy employees of our institution into other countries. That's number one. The second thing was that nearly 2 years ago, we launched a new Center for International Health Protection, a new department. And this department is only set up to make up cooperations, relations to other countries. And over this pandemic so far, we have supported more than 60 different countries. Yeah? Be it with videos where we teach people to have hygienic methods, how to wear PPE, be it with missions that we send to other countries, or be it with equipment that we send to other countries. And of course, also, it's a relation between the people sending back and forth. And so the challenges, apart from all the challenges that have been mentioned, and all of these I think we all have experienced these same challenges. But something was very impressive to me. We had a lack of PPE, absolutely. But in Germany, I wouldn't have thought that we had such a huge lack of information. You know, I mean, we are a pretty solid and wealthy country. And over the years, we have consistently asked for more data when it comes to the notification system. But all the things that we wanted to have, they were always negatively responded. But suddenly, during this pandemic, we were able to get this information. So What is the test capacity in Germany? We didn't know this. Now we know it. We have the ability to ask laboratories to give us the numbers, but only it's on a voluntary base. It's not legally binding. Capacity to intensive care units has never been known, because you go into the financing business models of hospitals. Why should they give you these numbers? Now we have the numbers on a legal base, so that we can put patients into place where we have beds free. So putting it together, we need all these indicators. We need indicators for epidemiology, for burden of disease, and for the health capacity. And these numbers and indicators, each and every of our countries needs. Each and every of our countries needs. And what I consider this is, we have to think when it comes to a public health crisis, we really need to be strategically, we need sound indicators, and then we have to be operational to bring this down to the ground. And there is so much to be done better. Although this information is around, it's spread, it's not harmonized. And so this is for me the most important topic here, getting information and getting trustful information with which we can inform the people. And the last sentence I want to say is, you know, Germany has a great national football team. And if you are on the World Championships, you have 80 million coaches. But during this pandemic, we had 80 million virologists. And this makes it really hard, I have to say. So you need a lot of trust and convincing all these people. Thank you.
Thank you very much, Lothar. I'll come to you in a minute, Stephanie, particularly asking you about the health diplomacy that's so important in this cooperation. But I'd just like to go back to John and Andrea, because Lothar highlighted, you know, how much this whole outbreak, the pandemic, and the responses relate, and the preparedness relate to data, and information. And information on the one hand for politicians and decision makers, information for the public health response, obviously, but also information for people. And if you look at it from your respective regional viewpoint, you know, Europe and Africa, how well are you set up in relation to these data, information? Where do you think we should be heading to? John, do you want to start this time?
I'll be happy to start. I mean, and I think Lothar mentioned, I like his tagline of trust. I think, and the currency, I'll just build on that and say the currency of that trust is reliable information and good data. I think that's what will bridge the trust between public health experts and the community, and then of course the policy makers, is good quality data. And I must say, at the start of the pandemic on the continent, we struggled with that, to get a quality, reliable data. But thanks to the networks that we had established before, the networks driven by the National Public Health Institutes across the continent, we gradually built on that and started a coordination called the African Task Force for COVID-19 that meets every Tuesday at 4 p.m. East African time to bring everybody together. So I think what the trust there element there was that to get the real data was that we made them own the response. I mean, like you get Chikwe in Nigeria, Marofi in Pasteur Institute in Morocco, Natalie in South Africa. We all constituted ourselves as part of the stakeholders. I mean, and they co-chair the working groups. So it wasn't a top-down approach which we dictated on them, but it was rather that you own it. So let's come together every Tuesday and share that. I think that started building trust and confidence, and data started flowing in. I think that, and are we there yet? Not yet, but I think we are better today with data collection, processing, analysis, and interpretation than we were in February when the pandemic just started. So I think that trust element, that somebody in the far northern part of the continent and the far southern part of the continent and the west and east will all come together in a very transparent manner and to work with them. And at times we connect with the European CDC, not at times. Every Tuesday, actually, we connect with the European CDC through our EOC to EOC to really discuss some of share the experience.
Thank you, John. We've just lost you, so I'll move to Andrea straight away because John also referred to that cooperation. And maybe you say a few sentences and then we move on to Stephanie.
Yeah, I fully agree with Lothar that cooperation in this pandemic is really essential. And as he said, I believe that the foundation for this cooperation is trust that has to be built not during a crisis, but before. And in that sense, both with our member states in the EU, but also with our international partners, we have been doing this and have actually intensified it now. Now, there are, regarding data, there are, of course, the trust issues, but there are also technological issues. And it's not only the breadth of the data that Lothar also mentioned, with a kind of data that we never had before, the number of tests, the ICU capacity, and so forth. It is also the timeliness, the real-time monitoring that is so crucial in such a crisis. Is where we have to think, what can we do to increase that in order to also relieve those that are involved in the reporting and have to do the case finding, the contact tracing, the case monitoring as well, from those more mechanical tasks like the reporting, and simultaneously increase the timeliness. The trust issue is then also on the data provider side, which is actually the citizens, where the question is, yeah, what happens with my data? And that is something where just really transparent, continuous information is helping. We have this issue with the apps, these contact tracing apps, that are really in different countries taken up with a different willingness and proportion by the population, that certainly has to do something with how far they trust that what's happening is with their data is transparent. Of course, it has also something to do with the technological savviness of countries, but I think the trust is really an important issue here.
Thank you, Andrea. Stephanie, Lothar spoke about diplomacy, about health diplomacy, about bringing countries together, bringing institutions together to work either at the regional level or at the global level with one another, or between regions, as we've heard from John and Andrea. What have you found to be particularly important if you look at it from your vantage point, on the one hand, being in the French Foreign Ministry, but also being a global health ambassador that comes together with so many different actors, countries, and organizations, also thinking G7, G20, there's so much going on. Can you share this relevance of health diplomacy for cooperation, that it helps these kind of institutions that are working, day in, day out?
Thank you very much for a great question, and I feel quite humbled by it, dear Ilona, and hello to everyone and my co-panelists and to the audience. Very, very pleased and honored to be on this panel and at the World Health Summit. We're so glad this is happening, even virtually. So to go to your question, I want to answer on two tracks. One is a quick reminder of all that was done when the epidemic set up, and then maybe a more personal commentary from having been a witness of how things emerged then. So quick reminder is, as seen from my window, which was that of France, is that very early on, or maybe not early on in the epidemics, but when it became the major national issue around the 15th of March, our president announced a lockdown, and also said in that same speech that he was soon going to get in touch with the chair of the G7, President Trump, in order to convene an emergency G7 meeting. And that happened a few days later, 15th of March. and that G7 meeting called for a G20 emergency meeting that happened on the 26th of March. And from then on, obviously the entire dynamic of what would the international community's response be was in place. And there were initiatives going on from all sides. There was naturally a very central role played by the WHO, which countries such as France were determined to give their fullest support to. But further than that, the question was a very political one, which was, well, how would international solidarity play out, and what concrete measures needed to be put in place, and at what level, and how would they be rolled out? I'm following up the historical, let's say, sequence that followed. Certainly, from a French point of view, what was very important was that this was treated at the right political level, meaning that naturally it was an unprecedented health crisis with an unheard of infectious disease, but we could all see even then that the consequences were going to be much broader, macroeconomic, a real risk of deep destabilization of many countries. And so the answer had to be much broader. It had to be the adequate one on the health side. And I'll go to that with enough means given quickly enough to uncovering the tools needed to fight the disease. But this could not be only about finding a vaccine quickly. This had also to be about ensuring that the entire equilibrium balance of what countries needed, particularly in the South, in order to hang on, was addressed. The further dimension of development and also the macroeconomic aspect of things. One of the reasons why France, together with other countries, Germany, the European Union, was very happy to join a call by African leaders, an initiative for Africa, in April, which indeed encompassed this entire dimension of need to address the debt issue, need to address the health crisis with proper health, financial aid for countries to access PPEs, equipment, and face the pandemic, sufficient humanitarian help, as well as also support to scientific organizations in Africa. So as an example of this all-encompassing vision which needed to be put together. So this, I think, was what was the immediate response of the international community. And maybe more specifically on the response to the COVID crisis itself. This has taken the form of the ACT Accelerated, Access to COVID Tools Accelerated, which was launched in April and has since been taken up with great dynamism, with figures such as the President of the European Commission stepping up, and very many countries and donors coming up with pledges which are being collected and consolidated. The idea being that this would go into financing broad access, possibly as universal as possible, access to treatments, diagnostics, and vaccine when they become available for all countries. So there's a huge dimension of obviously accelerating innovation in all these areas. There's a huge dimension of ensuring sufficient production, prices which could make at prices which would make these accessible. There's also a very important dimension of strengthening health system. At least it's a dimension that France has been constantly reminding everyone of, which means no other thing than ensuring that when the tools become available, they indeed can be distributed on the ground to those who need them, and with obviously the full and fulfilling the needs of countries, as i.e. in full cooperation, coordination with recipient countries. So this is what happened, and I won't be much longer, but I promise a little personal point of view on all this. I was struck when all this started. Obviously, we were all shut off at home with our little Zoom screens and making phone calls frantically all over the place. And this was the reality that we were all working on. And I'm sure this is very familiar to everyone here. And the feeling was one of fighting in the dark and trying to grapple with what could be done in this context. And what struck me then, and it's still the case, it's a complex thing, building a proper multilateral coordinated and response in solidarity to the crisis, but it did strike me that there was so much will to go forward. It was of such intensity. We were on the phone almost 24 hours a day, and at my level, certainly, but and I can only imagine what it must have been for our leaders and it was the case, I think, for all of us. An incredible push to try and do the best thing possible, and everyone trying to find out what that was. And looking back with a few months hindsight, well, it's still underway. We are all in this sort of retro sort of reverse experience of permanently trying to inform what we're doing and whether we're on the right track moving forward. But we are learning so much because of the emergency, because of the absolute life or death emergency of the importance of these efforts going about the right way. But this has been an amazing experience of, indeed, countries wanting to, and actors, also private actors, wanting to push together in the right direction. It's something we mustn't waste.
Thank you, Stephanie. And I saw Lothar nodding several times, and that actually links, I wanted to follow up with him because, initially when one speaks international cooperation, one's usually thinking North-South and, we need to do something for the global South, etc. I think, this crisis changed that significantly. And I'd like to hear from you, based on what Stephanie said, what changed and how did this cooperation from our living rooms and wherever we sit, I'm sitting in my home office here, and what was your experience both personally but also for Germany? What was the learning on cooperation here?
Yeah, it was the first month particularly were amazing solidarity. It was really outstanding offers. For example, the Robert Koch Institute, we have to basically coordinate on a national level. The offers from the IT sector, from whatever companies, offers for free to support, and really very, very many serious offers. Of course, there are always in such a crisis, there are also other guys who have some ideas, but the solidarity and the eagerness and the will to support and help was outstanding. I have to say, it was outstanding and was, I think, one of the most thrilling times I've ever have gone through. Not only because we had a huge pressure and it still is tough to do the work, but the solidarity was outstanding. I've never had more positive hormones driven through my bodies than in these days. I have to say, outstanding. But when it comes to crisis management, we have to face that ministers and governments are not crisis management units. Yeah, I mean, this is clear. A ministry has to provide the legal framework for a country. They have to provide laws. They have to make the framework, and obviously, the only way we have a clear strategic plan, at least I hope so, is military. But personally, I'm fully convinced that we need a clear strategic plan for international health security. That's the same, basically. This is something we need to be more strategically. You know, we filed a paper, a model of this in 2012. Robert Koch Institute took a model which was a COVID model, actually, a SARS model, and we foresaw basically everything. It's really of course, and but nothing was done. So strategically, we did all bad, and I hope this will last, and we will have to do this better the next time. And something that also is important to my understanding is that you know the Health Security Index, and you know, number one, the country with the best index is the United States of America, and obviously they didn't perform the best in this pandemic. So the whole architecture, the whole indicators that we are using, we have to question this. Or the JEE, the Joint External Evaluation. If you look at the outcome of the Joint External Evaluations, there's no association between the outcome of the pandemic and how you do in this. So obviously we need to have another view on this. We need to change this architecture. We need to be much more transparent. I'm, for example, struck by Vietnam, a country that doesn't have the highest technology and the highest hospital capacity, but they're doing best because they have local health authorities, local health teams that people are trusting for. So we learn so much from this. And this was very helpful for me, particularly in Germany, because I could convince political stakeholders to ramp up local health authority capacity. Yeah, this is very, very important. If you're living in a techno world and a high income country like Germany, medical people will look at, you know, individual medicine and molecular medicine and pushing for the newest technological innovation. But it's all about people bringing down on the ground what needs to be done. And there are various issues that need to be done without high technology, but we need to build on public health. Yeah? It's public health, and this is the time of public health, and each and everybody has to see this. And this is the last thing I want to say. Therefore, I'm absolutely convinced that we need to empower national public health institutions. Now, these are the institutions that have the biggest impact here, that have the expertise, and these are public health institutes, and they need to be public health institute. And you need to have here an independent academic institution that wants to bring people onto the ground. So we need academia, of course, and it's very important. But the National Public Health Institute, they bring the academia onto the ground, the science to make it happen. And this is a plea from my side. We have to strengthen these. And then we have this fantastic IANFI, the International Association of National Public Health Institutes, that really makes a difference. We are talking so often to each other, and it's so important to do this. And so, you know, we always need to keep an eye on the basics. Never forget the basics. We need science and innovation, but never forget the basics. That's basically it.
Thank you for that, Lothar. And as you know, there have been, you know, people who've been pushing for stronger public health, for example, in Germany. And for us, it was unbelievable when we suddenly heard that, you know, at least one positive result of this crisis is a significant investment in local public health. I think 4 billion euro. An extraordinary thing. And now, of course, we have to work that they are really spent well. That will be, you know, the next really important part. But Andrea, the minister that has also moved this forward within Germany, has continuously said, you know, also the ECDC should be strengthened, should have perhaps new functions, should be able to act much more independently. I don't know, you know, in terms of your function, how much you're allowed to comment on that. But could you share with us how, you know, and Stephanie, I will then ask you later about this European Health Union stuff that's floating around. But maybe you could tell us what you think is absolutely essential for the ECDC to be stronger, to be better prepared, to help countries better. And then I'd like to ask John, to what extent your experiences have shown what really makes a difference for a strong regional CDC. And wonderful, I'll say hello to George. Thank you that you're joining us, and I'll come back to you in a minute for our discussions. Please, Andrea.
Yeah, thank you. I mean, when I heard this the first time, I was, of course, very pleased. The background is that we got questions and demands, requests that we couldn't meet because of our legal mandate, but also because of resources. And when this happened more often, then apparently the consequence became clear that if countries want something from us, they have to give us the means so that we can do that. I mean, in principle, currently the ECDC is providing risk assessments, and the countries are responsible for the risk, meaning implementing and carrying out any measures. So we can give scientific guidance for these measures and options, what the countries can do. But in the end, the countries can pick whatever they think for their countries is the best solution. And that is fine, and it's necessary because, I mean, you couldn't, as Lothar said, from a European level, we cannot decide the local context. So that has to be decided on the local level. However, when it comes to anything that involves comparing countries, as it is now with the notification rates and the testing rates and these kind of things, there, of course, it matters that the implementation of the basis for these measures is done in a streamlined fashion. So we have provided strategies, whom to test, which groups, how to go about with a population-based system for acute respiratory and severe acute respiratory infections. But countries, of course, according to their national systems and to their capabilities, of course, also have implemented these in different ways. Naturally, the figures that come out of this are also, in principle, not comparable. And that is what is sort of haunting all of us. I mean, not just us, but I think also the countries. And so in July, there was a health council that proposed a number of elements that we should look into innovative solutions, digital solutions for surveillance, that we should help streamlining preparedness plans, that we even would be able to give recommendations, even though they would be non-binding, which of course is opening the door already that this will be done in different ways. But also that we should have enough resources to have a task force that can support the countries in times of crisis. And lastly, they called for further global visibility. And that had the background that they asked us at one point when it was about opening Europe for non-EU countries to assess the validity of these other countries' data. And we said, well, we have no means of doing that. And I think that was sort of the last drop in the bucket that said, okay, we have to do something. Now the Commission is working on legal proposals that will be put forward to Council and Parliament in November. That will then go through the whole decision process, and I believe that it's then where it will show what the countries really are willing to do. not only in terms of mandate changes, but in terms of resources that they are willing to put at this. Because I made it very clear, with our current resources, they can ask us anything else, but we cannot do it. Other than stopping large parts what we're doing right now. So that is right now going on, and I mean I'm happy to take more responsibilities, but I need also the resources to do that.
Thank you. Sounds like a WHO discussion, I think, you know, with member states asking WHO to do more and more, but not providing it with the resources to do so.
Yeah,
but
there
definitely
are similarities.
but there's a significant movement going on, you know, strengthening ECDC, looking at the European Medicines Agency again, creating a new agency, a sort of European BARDA. And some people are even saying, take them all together and create one big European health agency. So it will be interesting to see how that discussion goes forward. Before we think more about that, I'd like to go to John and ask him, you know, what are the kind of lessons you've drawn from working, you know, with many African countries at very different levels of development of their public health systems. I think maybe not even all of them have, you know, full-fledged CDCs in a way. They will, of course, have public health responsibilities. Can you share some of that with us and how you think your agency could or should be strengthened? Do you have similar discussions like the Europeans, you know, saying strengthen ECDC? Or do you feel, you know, we, the African CDC, have all the responsibilities, functions, possibilities we should have?
Thank you. Let me first of all, on a light note, say, Andrea, if you have some more resources, send them also our way, share, so that we can strengthen Africa CDC. I think that before I answer that question, Elena, let me go back to what Lodat mentioned, because you touched on some critical elements that I want to underscore, because that is, I've said that in many of my briefings, that have been the whole concept of stepping back and looking at JEs, and also stepping back and being honest and humble with ourselves and saying that the Global Health Security Index is important. I think all what the JEs and the Global Health Security Index tells us is that we are in need of a tool that would guide us as to a compass where we are with respect to our health security needs. I think we also have to be humble to say that, to answer the question, if those tools have served us this time appropriately. I think that is a discussion that I'm looking forward to having. I'm happy that Lodat started bringing that up, and I'm pleased with that. The third thing that we need to step back and look at is the whole concept of the IHR. So what are some of the key components of IHR that we need to look at, reviewed critically, and also empower it? If WHO is driving that, is no point, as the saying goes, saying somebody break the law if the laws were not known to the population. So I think we have to look at that. Like the whole travel policy, when this pandemic was taking full momentum, I think there were discussions on the continent as to what do we do? Do we shut our airspace? So at any rate, we kept, as the voice of the African Union for this, I kept saying, well, as per the IHR regulations and WHO, we cannot do this. But countries went ahead anyway and shut down borders with us. So it means we have to look at that very, very carefully. That is JEs, Global Health Security Index, and health security. And I also like to underscore what he said about stepping back and looking at our overall health architecture, health security architecture, and teasing out from a global level to regional level and national level. Health security is meaningless if we have these broad discussions at global level, and then at national level, you cannot implement it, or you cannot impact it, or at regional level. I think my submission is that more and more you see more regional authorities trying to create their dependence and then federating with a global discussion, and not vice versa, where we wait as a region of 1.2 billion people for instructions to be issued, say in Geneva, then we implement that. I think this crisis is teaching the continent of Africa that we have to begin to create our own dependency on certain things that it can take as a continent of 55 member states, 1.2 billion people, and then coordinate that rather than depend entirely. I say this because it took us more than 9 weeks of discussions where the diagnostic task force in Geneva, where we were waiting for diagnostics. And then after 9 weeks, we were told that as a continent, you get 2.3 million tests, which were extremely ridiculously low, that we had to set up our own platform called the African Medical Supply Platform, which and work with China to get diagnostics onto that platform to serve our member states. I think that's a regional effort that speaks to the fact that we couldn't be dependent on a global dialogue that is taking place in Geneva. We had to take our future, our health security future into our hands. So let me then address the question of the different levels. I think as someone said earlier, you don't fix your health systems when you need them. You fix your health system before you need them. So the African countries, of course, are very different layers of their preparedness. As we speak, about 16 countries have a functional national public health institute. We hope that over time, this will become a general practice across the entire continent. I think that is the foundation of what Africa CDC is promoting, that we really have national public health institutes across the continent that will serve as the foundation for our health security going forward. So you take countries like Somalia, Libya, South Sudan, and so they are at very different levels. I think then we have to prioritize support for them. And then, of course, countries like South Africa, Morocco, Egypt are at very different levels, and you have to say, okay, we'll take a wait and see attitude if they come to you for a request for support. So I think that I will just conclude by saying that the continent is at a point where they recognize that an Africa CDC was very timely because it has the respect and has enjoyed the support of all head of states. I've briefed the head of states 8 times. I mean, the Africa CDC, despite his 4 years, 8 times, where President Ramaphosa, in his capacity as chair of the African Union, has exercised tremendous coordination ability, where he brings 15 of them all the time, and they put Africa CDC at the center and say, tell us where we are going with this pandemic. Where are the things we should be doing? And then, so I think that is very powerful. I think we should take that as an opportunity that has emerged from this crisis. And they have also said, they themselves, after 2 briefings, they said, we are going to contribute more. They started pledging monies to support Africa CDC's function. We hope that at the end of this crisis, they will have a comprehensive dialogue to even approach that from a more coordinated approach to make available financial resources that will enable Africa CDC to support countries to develop their national public health institutes. So I see a silver lining at the end of this crisis if we as Africa CDC continue to deliver and then win the trust and the respect of the head of states, the way and manner in which I have seen them invest and show trust to us.
Thank you very much, John. Can I move on to George, please? George? Very happy to have you with us. So glad you could join us. George, could you share a little bit with us and the audience exactly, how the Chinese CDC works? Because we've heard from John and from Andrea, working with different countries with large populations. You, of course, are one country with a very large population, a decentralized country also in terms of various parts of China. And at the same time, if you could share with us also, on the one hand, that cooperation within China, and which international corporations has your CDC particularly had over these last 10 months or so? Could you share that with us, please?
Yeah, hi, Ilona, Lothar, Andrea, John, Stephanie. I can see these names here in my screen. I'm sorry, somehow I couldn't get it connected. Yeah, as you know, I always called in China, we already have at least 7 waves. Why I would say that? In the first very big wave, that in Wuhan, everybody knows that, because by early April, we get everything clean and clear in China from Wuhan. We declared on April 8th, so no more cases in whole China. But meanwhile, we have so many imported cases, but there was always no local transmission for a while. And then suddenly, sometime mid-April, we have some imported cases from Russia, Europe, and then we had a local transmission in northeastern provinces. There in Jilin province, Heilongjiang province, neighbor to Russia. So this is the first local transmission outbreak. Very small, very small. And then you have Beijing, Xinfadi seafood market. And then you have Urumqi outbreak. And then you have Dalian. Recently, you have Qingdao. And as you already know, starting from yesterday, we have some cases in Xinjiang, in the region near Pakistan. A very small number at the moment. I also have sent my colleagues there. A lot of my colleagues now, they are working there. So anyway, so you can see clearly, we have very clear cut for those waves. And then we can always try to find patient zero. It's so easy so far. And who is a patient zero? That we trace back by the epidemiology. Meanwhile, we did all the sequencing. So from the sequencing, the virus, what it looks like. The virus, imported from somewhere. You compare, by shape or by, land neighbor with some countries. Anyway, that's so clear at the moment in China. Of course, we shut down almost the society in Wuhan, but we opened up the economy and the society. Of course, it's ourselves. We almost still closed down with other countries. This is the problem for the international trading, international interactions, and a lot of pressure at the moment again in China. So in general, inside of China, after we are so successfully control the outbreak in Wuhan, so far, though, as you said, Ilona, China is such a big country. You are talking 1.4 billion people, all over China, and especially some cities in the east and southeast region, the density, the human population density is so high. So it's very hard, but I should say so far, so good. The key point is active finding from any possible community level transmission. So this is what we have done, because you can always have a clear cut. If we don't have this clear cut, we never clean up from one region. That would be very hard for us to trace back the patient zero. So far, we are in a good position. However, you look forward, because we are approaching to the winter season. Once in the winter season, we will have a mixture of the COVID-19, flu, RSV, adeno, so many viruses, and also so many bacteria like streptococcus. All this will be there. I'm not quite sure how we are going to deal with this, with a mixture of the different kind of pathogens there. So we are, working very hard to make sure, we could really do something. Another point I want to make, Ilona, because in China, we have very good local CDC system. The staff, they are working, in the local CDC, Chinese hierarchy system. You have province, you have national CDC, provincial CDC, you have prefectural CDC, and then you have county CDC. Those 4 levels help us to always try to identify the patient zero, and then trace back after that, we will do the sequencing to say whether or not it's any connections with neighboring provinces or imported cases. We always, so far, we can also trace back. The recent one, as you know, in Qingdao, we traced back is some workers on the ship when they carried those seafood package. So in the package, on the surface of the package, China CDC, we managed for the first time isolate a live virus. And 1 week or 10 days ago, we made this announcement. And then that virus is closely related to the patient in the hospital. For that, big city, Qingdao. So Qingdao is a very big city. They have historically, they have very close relationship with Germany. So anyway, we only have less than 20 patients, from that small outbreak. So this is what I want to say. The second point: active case finding in the local community is the key. So you have to address the local community level, especially in the county level, and even sometimes the township level, to get to identify the patient zero, to do the sequencing, and to trace back the origin of everything. So that really works so far for China. Now, the third point of we are in a big, I already said that, we are in a big challenge at the moment because the winter is here. So this is the season in China. Usually you have so many flu patients, so many SARS patients, so many ILI patients. So we have to be really careful for the next step. Thank you. And also, by the way, John is here. As you know, John, we are almost ready to help for the building of Africa CDC. I think we recently had a meeting. Almost we are in the final stage for the building of Africa CDC. Thank you. That's my briefing where we are. I'm ready to take any questions. Thank you.
Thank you very much, George, and thank you for giving us a better understanding also of the Chinese situation, and particularly, and I think the European participants in this panel are listening closely because of this winter season coming on, and the difficulties in terms of the spikes of infections we're seeing in many European countries to actually do what you do, to be able to go back and track and trace. And some panelists might have some comments on that in a minute, but I do want to go back to Stephanie and also introduce a little bit a political component to this discussion, because of course, also when we said, and Lothar drew our attention to that, the weaknesses of mechanisms like the JE or the Global Health Security Index, we've of course seen that the best of institutions don't help you if politics don't follow. And even in terms of preparedness and willingness to invest in health, it of course needs very top level senior political decisions and willingness to move forward. And one thing that has caught the imagination, of course, of many European public health proponents has been a term I think your president first used, the European Health Union, that Europe must come together in new ways. On the one hand, to strengthen health within the Union, but also in terms of the global responsibilities of Europe and the European Union. Would you share some elements of that with us, please, Stephanie? This political component that we have to put into our equation.
Well, with pleasure. Thank you for a great question, Ilona. And indeed, I was listening very with much interest to the previous intervention. So indeed, President Macron and Chancellor Merkel on May 18th called for strengthening the European response to the crisis, and beyond that, to indeed favor a much stronger Europe in terms of health. So that came quite early on after the crisis, and is definitely a push that we're feeling. I have to say that President von der Leyen, as well as President Charles Michel, have also been expressing themselves quite strongly. A few preliminary points. Just, well, first of all, I think what happened with this crisis, we've seen that it's disrupted European economies and European societies and European health systems to a great level. And maybe I'm jumping the gun a little bit, but we do feel that there is a push and an expectation from our citizens now for the European response to be greater. And I'll probably come back to that, and also going back on what Andrea said about strengthening ECDC, which is definitely a French position. So that's the one point. Another one is, of course, that the paradox is, and it's well known to people who are familiar with the European system, is that health isn't an integrated policy in the same sense as others can be. We do have an Article 168, in the treaty, which provides for coordination, strong coordination in a number of areas, and indeed very important European agencies such as the ECDC, but also the medical agency as well. So this is to say that health policies, the decisions, organization, provision of health products and services are very much the national field of member states currently. So what is basically the question that we have now is, how do we actually make this stronger? Will we go to the treaty? Is there is the option open to actually integrate health policies to that level? Well, before we get to that, that's definitely it would be a very, very exciting debate to have for member states. Probably will remain open, but for the time being, we certainly have other areas which we can explore without delay, and many proposals which are on the table. And let me maybe quote two areas and a third question and a third point. The two areas are obviously emergency response. This is what we've been talking about since the beginning of this great panel. And there are at least 3 areas in that field which we are already moving forward with. So one has been already gone into, and that is strengthening the European Centre for Disease Prevention and Control. I'd be happy to go a little more into detail, but definitely a direction which France as a member state supports, and this has to be done in great detail, evaluating the response and giving the right answer with the right resource, obviously. Another area of interest is that of strengthening or creating or possibly a biomedical advanced research and development agency, BARDA, not necessarily modeled strictly on the American BARDA, but completely adjusted to our European setup. And the president of the European Union has made that proposal, and it's definitely an interesting option to be looked into. And the third area in response, and that sort of now spans out more into more structural aspects of health, which is how do we improve our dependency, or sort of get out of the situation of dependency for supplies of medicine and devices that we found ourselves in with a crisis, dependency on non-European productions. And this is definitely an area to be reinforced. There was work on this before the crisis, but this will definitely be accelerated. So 3 examples of directions in which we can go straight ahead without going to the treaty, in order to build on and quickly, as Lothar was saying, learn from the crisis and improve our response to the crisis. Further than that, there's also, that's my second point, certainly a wish to strengthen the health dimension, the health coordination and health rather, beyond emergency response. And this is what the EU for Health program, which is currently being negotiated, is about. And this, and it's certainly a direction that France is very interested in and will want to to take as far as possible and reasonable. This should lead to increased cooperation and coordination of health policies with European added value, which is the whole point of doing things at European level, for building a proper health data system, or space, rather, environment for data, for health data, better policies for cancer, also promoting the One Health approach, see how we are able, and this was always done well at European level, to address the determinants of health linked to the environment, linkages between environment and health, as well as prevention policies. And finally, 2 more points maybe in this.
Stephanie, can we? I'd like to give some others the word
in that
as well.
case, I won't go much further.
Very short, please.
I need to finish with the political aspect, which you said. All of these won't have any meaning if they are not encompassed in a political vision. And this is a point that I really want to make, is that we Europeans, and I know we're speaking in front of others who are not, do not give enough value to what we have. And what we have is that we do implement universal health coverage in different ways in our different countries. But this is a common vision that we have in Europe, which doesn't exist to the same extent in other places in the world. And this is something which needs to be the overarching sense that we give to this new European health union. Thank you very much. Sorry for being so long.
Thanks, Stephanie. I just have to, try and balance things. So please don't think
That's
me
fair enough.
So John, how would you relate that to your work? The whole attempt to build universal health coverage in Africa, some countries, again, much further advanced than others. How much is if I simplify it, the health security discussion linked with the UHC discussion?
I think that they are very, very, very much linked. My hope and wish is that when we get out of this crisis as a continent, we should be coming out stronger than we went into the crisis, which is we frame the discussions not in the context of the global dialogues, of course, global health security and universal health coverage, but we also step back and look at our continental aspirations. Africa has 2 big continental aspirations. One is our Agenda 2063. And in there, health is really a priority, is aspiration number 1. I think the way that the continent achieved the universal health coverage and the global health security agenda is via the strategy that we've put forward called the Agenda 2063, the Africa we want. And then next to that, we have the Africa Health Strategy, which was built in 2016 and goes up to 2030. This current crisis have actually exposed us that we have to take that agenda, that is our Health Strategy 2016 to 2030 seriously and look at the dimension. It's amazing when Stephanie speaks and Andrea that the similarities that exist in terms of institutions that needs to be strengthened. One is the Africa CDC as a regional body that would help drive that. Second is the African Medical Agency, which is being, the treaties are being signed there. A lot of similarities with what Stephanie and Andrea mentioned. And I think without that the political commitment underpinning all of that, it wouldn't go anywhere. So I think, as I said earlier, the time is now for us as Africa CDC to continue to elevate these issues to the highest level of the leadership of the continent. And we are doing just that. Just 2 weeks ago, we published a paper in Cell, which I'll be happy to send you, colleagues copies there, where we talked of a need for Africa to develop a new public health order. That has 4 dimensions. One, the first dimension is strengthening Africa CDC and the National Public Health Institutes. Second dimension is workforce development for the continent. None of the things that we are describing will matter if we don't have a competent workforce development. The third area there is local manufacturing of diagnostics, vaccines, and pharmaceutical. We import literally everything. Until COVID hit us, we had no diagnostic capacity, manufacturing capacity. but this is a continent that conducts 150 million HIV tests a year. Yet there is no company that produces a rapid test, a simple rapid test, which I used to produce in graduate school. And then lastly is really the need for coordinated efforts with the partners so that we can focus you, the partners, into our agenda. And that way your investment and energy goes into responding to our herd continental aspirations rather than an agenda that is conceived outside of the continent and put on us. So I think that's the way we look at this, and we really hope that this dialogue will continue so that the partners like you, European CDC, China CDC, the German government, and I really want to use this opportunity to thank the German government for really a lot of diagnostic tests that we have received from the government of Germany. Just before the crisis, we signed an MOU with the European Union, and through that we got $20 million. So I think that kind of cooperation, and of course, George, hello, George, good to see you. I mean, you said, I can't wait to see you back in Addis Ababa. So I think with the kind of partnerships that we've developed there, I think we are very comfortable that we are on the right path.
Thank you, John. And I'd like to say to the audience, you can see that these people are really working together day by day. They don't only know each other's offices from Zoom, I guess they also know each other's living rooms and home offices and I don't know what not, because one is constantly in contact. We have about 15 minutes left, so I've got a couple of rounding up questions to each of you. If you just, give a short commentary. First, George, to you, following also from what John said, to what extent China has become much more active in global health. There are such close relationships also of China CDC and Africa CDC with many African countries. Your president has said that, the vaccine also being developed in China should be a global common good. Could you give us a bit of a feel for these collaborations and where you hope they will be leading to?
Yes, I think, George comments about the China's involvement for the collaboration with Africa. So as you know, I mentioned my last comment about the building. The building will be there. Of course, diagnostic kits, John knows, and especially from BGI, one of the China's company, and they supplied so many diagnostic kits. And for the vaccine, our president already promised that will be the international product, international public product. I think we will be in a very good position to collaborate with everybody. At the moment, we have, as you know, inactivated vaccine, because that's to produce so many doses of the inactivated vaccine, you need a PSR-free lab. So China CDC, from the very beginning, we contribute almost half of our facilities to those companies. They are producing the products. So this is why the inactivated vaccine is already in the front line. So 3 inactivated vaccine, one adeno5 based vaccine. Another one is a protein subunit vaccine, finished phase 2 last week. They will start the phase 3 clinical trial. So I think China CDC in a very good place with John for the contribution for both diagnostic kits and vaccine, for Africa. So we need to discuss this, maybe for the next meeting to see how we should do that. As you know, our government already committed. So once the government committed, the China CDC ourselves, we just push very hard. So once we are pushed, we push. We are pushed, we push. And then once we are in that position, I think you will be in a very good business. We can discuss this one in detail. Thank you.
Thank you very much, George. Lothar, you are involved in one of the big governance discussions that's going on, and that is, revising the international health regulations. When you were speaking earlier, you also drew attention, as did some others, in some of the gaps and some of the criticisms around the international health regulations. You're chairing, this first committee that is looking at potential changes. Could you give some indications of, particularly in terms of the collaboration between countries, the information flow between countries that we touched on earlier, where perhaps, from those discussions, obviously no secrets from the meetings, but what do you think are the kinds of governance issues as a global community, if we want to be more solidaric, do we need to address?
Yeah, sure. Thank you, Ilona, for coming back to this. Obviously, this is an ongoing discussion. We just started 6 weeks ago. The committee is made up of roughly 20 members, very distinguished colleagues from various countries, and the discussions are very intense, but of course they are still preliminary. I just want to highlight one issue here that is very important, I think. It must be very clear that this IHR is a legal body that has to be implemented by the countries. Yeah, they have to implement them, and you cannot make them responsible for it. They have to implement it. They have to live it. And something that happened in this particular situation here, because it was the first pandemic that we've really experienced, or we're still experiencing. What we think is, we all know that we need as soon as possible information from the particular party that identifies this particular pathogen for the first time. And this will only work if the country that gives this information to the world doesn't suffer from this information. And I think what happened here is that many countries, and I'm not speaking now only of one country, but many countries that gave the information as soon as possible were not basically given credit for it, but they were in some way punished for it, particularly because of travel restrictions. And so this is, we need incentives. We need incentives if a country, and we want each and every country to give information as soon as possible, of course, serious information, valid information, but then the country has to be incentivized for this. And here is the big question: how can we bring this break? How can we basically bring this break again together? Yeah, this is a major topic here. This deal, to my understanding, has been broken during this pandemic, and this is a big issue. What will be the incentives? We are thinking about this. We will see what comes out of this. But I think this is at one of the heart of the discussions we have.
Thank you very much for that. And, this discussion between sanctions and incentives and responsibility and solidarity is one that obviously will be very, very critical. Andrea, there's also a discussion, of course, within the European Union around the next steps in terms of, vaccine development, etc. Can you share one or two things here for the audience? There's been some questions that I've seen, and the involvement also in terms of international cooperation. Maybe you want to say a bit about how you work with the European Office of WHO, and maybe also with developments in the ACT accelerators. Just share that with us, one or two short issues.
Okay, thank you. Regarding the vaccine development, I cannot say much because we are not involved in this. Yes. It's our colleagues from the Medicines Agency that right now are really at the heart of this. What I can say is that we are working with the colleagues from EMA on setting up a platform for a system that we can start monitoring the safety and the effectiveness of the vaccines as soon as they are licensed, because the safety and the effectiveness are the two topmost concerns that people bring forward when they say, well, they are really not sure whether they want to take this vaccine. So we want to really give the confidence that we are monitoring from day one what is happening there. Regarding the international cooperation, I mean, we have been working with institutions outside of the EU since years. With the Western Balkan countries, with the EU neighborhood policy partner countries, and with CDCs like the US, the China Cdc, Canada, Africa. And we have now seen that we during this pandemic, we have strengthened this cooperation. We have put focus on it. Really issues that are of common interest, where all of us really struggle, but everybody has a piece that could help the others to move forward. So experience sharing and good practice sharing was a big part. We have also broadened the collaboration in terms of in particular, the eastern part. So we have now also collaborations and regular contact with the CDCs in Korea, in Singapore, in Thailand, that have different approaches where we can learn from in terms of how to cope with this. And we do this, the interactions more intensely and more frequently. So we have regular meetings with the colleagues, and that has been very, very helpful. Now, WHO is, of course, a very special partner for us. In particular, the Regional Office for Europe, because they have a similar remit, of course, as we do, and we work really on a daily basis. Not so much in practice sharing, but really in developing a joint guidance so that the member states actually are not faced with double advice, and if worst comes to worst, with diverging advice, but also with reducing duplication. So that has been the whole positive outcome, in my view, of this.
I have to push you on. We have 3 more minutes, and I want to give 1 minute to Stephanie and 1 minute to John. Stephanie, there's a big global health conference planned by the European Union next year. 1 sentence, what should its outcome be?
Well, certainly a stronger European Health Union.
Okay.
With strengthen inward, but with obviously a much stronger, more global role.
Thank you. John, if you look at the situation right now, what are your expectations towards global solidarity?
So 2 things, actually, Elena, is that one, this crisis is teaching us how vulnerable we are all together as a species living on the same planet, how connected we are, and how the inequalities that exist. I think we really have to look at discuss a pandemic and outbreak governance. So is that the dialogue that we have with the vaccine, protectionism, nationalism, should cease. It shouldn't be that discussion anymore. If you look at 2009, during the H1N1 outbreak, and you color up 2009, you think we are in 2009 with the same conversation. I think through a very deliberate global governance on pandemics and outbreaks, it will resolve that. And built into that is really the issue of, I really want to close with the issue of the need for national systems and regional systems to be institutions to be really highlighted in the overall architecture of health security. And lastly, that health diplomacy should not and cannot be a zero-sum game where there's some partners work with only some partners work with people like groups like us, like Africa CDC. Africa CDC should be a platform to encourage global cooperation with all our partners, the China CDC, the US CDC, the European CDC, the Robert Koch Institute. That is a platform, that is what will make us as a continent be happy and know that global health diplomacy is in play. Thank you.
Thank you very much, John. Thank you to this wonderful panel. It's been a fantastic discussion. I think we've been able to touch on many issues: technical, political, organizational, governance, a whole range of challenges. I'd like to thank the panel also for being so flexible, that we took up issues that arose and didn't, sort of follow the script like this. I think that made it much more lively and much more interesting for the audience. I think we've all learned, and I think what's really been wonderful is to experience the extent to which it seems you have built up also trust in each other's agencies, trust in cooperation, trust also in the professionalism of the colleagues. And I think that bodes very well for future cooperation. Thank you very much. And you will be on other panels in the World Health Summit, of course. And thank you for your commitment. And we know how hard you work. And let's hope, at least at some stage after this winter, you all get some rest. Thank you very much. Thank you. Bye-bye.
Great. Thank you.